Welcome, everyone, and thank you for joining. My name is Laura Wolf, and I represent Blue Cross and Blue Shield as one of the 10 TRS district ambassadors who support the benefits administrators and leadership. We assist with general plan information and education or by attending health fairs and presentations such as this one. Today, we'll be discussing the robust program offerings included in your TRS medical benefits, along with the tools and resources to help you maximize your benefits because we truly are healthier together. Let's begin by reviewing the plan highlights for the two plans that are on the physician-driven statewide network, the TRS Active Care Primary Plus and Active Care Primary. The Primary Plus plan here on the left is a plan that offers a lower deductible and copays for many services and drugs through a higher premium. Now, the plan on the right has the lowest premiums of all available plan options. Both plans provide access to the broad statewide network, which is curated specifically for you, and you have a user-friendly provider search tool to confirm your provider doctors are within the network. Additionally, both plans require that you select a primary care physician or PCP who will refer you to specialists. These plans do not offer out-of-network benefits except for true emergencies, and they do not work with a health savings account. Now, as a reminder, preventive care is covered at 100% when using your assigned PCP, which means no out-of-pocket costs owed by you. I'll give you a moment to review this slide, which shows a breakdown of premiums for the statewide plans after subtracting the state and district minimum contributions. Great, now let's review the plan highlights for the two plans that are on the nationwide network, TRS Active Care HD and Active Care 2. The Active Care HD plan on the left is a deductible plan that has a lower premium and works with a health savings account so that you can pay for medical care and drugs tax-free. Now, on this plan, the deductible must be met before the plan pays for non-preventive care. Now, let's look at the Active Care 2 here on the right. It's closed to new enrollees, but if you are an existing participant, you can stay enrolled in this plan has a lower deductible and copays for many services. Both plans do not require you to select a PCP, and referrals are not needed for specialty care. Now, as a reminder, preventive care is covered at 100% on these plans when you use in-network providers, again, meaning no out-of-pocket costs owed by you. And here's a breakdown for premiums for the nationwide plans after subtracting the state and district minimum contributions. Now that we've reviewed the plans on both the statewide and nationwide networks, I want to take the opportunity to highlight that your coverage includes TRS virtual health choices powered by Teladoc and ReadyMD. Now, these services allow you to access convenient quality healthcare from home or on the go without ever having to travel to the doctor's office. To the left is a virtual health option through Teladoc. They offer services for general medicine, including a variety of acute, non-urgent conditions. Now, this is free for participants on the Primary Plus, Primary, and AC2 plans, and at a $30 cost for those on the HD plan. Confidential mental health services for adults 18 and older from a licensed therapist, psychologist, psychiatrist, or certified drug and alcohol abuse counselor are also available on all four of the TRS plans for a fee per appointment. The Primary Plus, Primary, and AC2 plans have a $70 copay, and the HD plan has a 30% coinsurance after the deductible has been met. Their phone number is 855-TELEDOC or 855-835-2362. Now let's shift our focus to the right side of the screen to ReadyMD. They provide quality primary care medicine with live face-to-face diagnosis and treatment via the internet or by computer or smartphone, as well as services over the telephone. Now you can see and speak with a board-certified physician 24/7 who can diagnose and recommend conservative treatment. Now again, this is at no cost to the statewide and AC2 participants and has a $30 fee for those on the HD plan. Their number is 866-989-CURE or 866-989-2873, option 3. With both virtual options, you can have prescription medication sent right to your home when medically necessary. Next, let's talk about the ID cards. Now, with this being a passive enrollment, new cards will only be issued for those making plan election changes or those currently on the HD plan due to the printed benefits that have since changed. ID cards for the physician-directed statewide plans will have the subscriber's name listed, as well as one covered family member and their associated PCP. That means that every covered member on these plans will have their own ID card. A sample of the ID cards for this is shown here on the left side with the blue circle on the PCP indicator. ID cards for the nationwide plans will have only the subscriber's name on the card, and they will never have the spouse nor dependent's name. A sample of this ID card is shown here in the middle. Individuals on the nationwide plan will receive up to 2 ID cards per family. You can order additional replacement cards, ID cards via Blue Access for Members, which is a participant portal. You can do it directly through the Blue Cross and Blue Shield Texas app or with a personal health guide. We'll discuss these resources in a bit. Now, although both networks offer a robust access to care, there are some key differences. The statewide plans offer in-network coverage and are physician-directed plans, meaning participants must select a PCP, referrals are required for specialty care, and you have access to the statewide network. Now, the plans on the nationwide network include the Active Care HD and Active Care 2, and both plans offer in-network and out-of-network coverage. Note, they do not require PCP selection, nor are referrals required for specialty care. On these 2 plans, you have access to care nationwide. Now, regardless of the plan you choose, you can choose with confidence knowing that both Blue Cross and Blue Shield networks provide you with emergency coverage anywhere in the world. You receive the highest level of benefits and pay less for care with in-network providers. You have protection from billing over the allowed amount, which is called balance billing, and this protection comes by seeing in-network providers. Now, both the statewide and nationwide plans provide coverage for out-of-state covered dependents. The nationwide plan already provides this coverage without any additional steps. However, dependents on the statewide plans will require an attestation form be submitted before they'll have access to coverage outside of the state. Now let's take a moment to better understand how deductibles will work whenever covering a family under any of the TRS Active Care plans. Shown here in the box on the left side of the screen is an aggregate or non-embedded deductible structure, in which it's a requirement for your family to meet the entire family deductible before benefits apply to any individual. This amount can be met by one person or a combination of people on the plan. However, if you're enrolled in any of the TRS Active Care plans, you have an embedded individual and family deductible, which is seen here in the box on the right. Now, with an embedded family deductible, each member of the family has their own individual deductible, and all individual deductibles feed into the family deductible. This can save families money if one family member incurs a lot of medical expenses. Now, once an individual's deductible is met, plan benefits begin for that person. Once the family deductible is met, plan benefits begin for every person active on the policy, even if all individual deductibles have not been met. As a reminder, once the person meets their individual deductible, they'll no longer contribute to the family deductible, but instead all coinsurance and copays will count toward the maximum out-of-pocket. Now here's an example to clarify this plan feature. Lisa is a district employee covering herself, her husband Javier, and their baby Anna on the TRS Active Care plan. Each covered member for the Juarez family has a $2,500 individual deductible that feeds into that combined $5,000 family dollar deductible. Now, moving from left to right in the box, we can see the medical expenses each member of the Juarez family has. Javier's cost of $250 means he has not met his $2,500 individual deductible. Lisa's medical expenses totaling $500 means she also has not met hers. But looking at the far right section of the box, you'll notice that baby Anna has incurred $4,000 in medical expenses, which means she has met her individual deductible and now is only responsible for 30% coinsurance for certain medical services. Now, the coinsurance and copays paid for Anna will not go toward her family deductible, but instead will be applied toward the individual and family maximum out of pocket. The remaining family members, Javier and Lisa, they'll continue to work toward their own deductible limit until the family combined has met the $5,000 family deductible, or they meet their own individual deductible, whichever happens first. Now that we've discussed the difference in the plan offerings, I want to dive deeper into the importance and the advantages of staying in network, which include receiving the highest level of benefits, which means keeping more money in your pocket. You don't have to file any claim forms. The providers do that for you. And balance billing is not allowed, giving you protection and added peace of mind. Now, although the Active Care HD and Active Care 2 plans offer out-of-network coverage, You get the most from the benefits when you stay in network. When you go out of network, benefits will pay at a lower level, meaning you pay more out of pocket for care. You'll probably have to file your own claim forms, and providers can and will most likely balance bill you. Now, as a reminder, TRS Active Care Primary Plus and Primary plans do not provide any out of network benefits, and non emergency claims for out of network services will be denied. We want to take the opportunity to stress the importance of getting regular annual checkups. Keep in mind that preventive care is covered at 100% on the statewide plans when performed by your assigned PCP, and on the nationwide plans when performed by an in-network doctor, meaning you keep more money in your pockets. It's also important to remember that lab tests related to an illness or condition, they're not considered preventive and are covered under applicable deductible and coinsurance levels. So if you have diabetes or asthma, this may feel quite normal to you, but I point this out so it doesn't cause confusion. Now, if you're newly eligible or if you've already had a plan but haven't selected a PCP, you may be wondering why on earth is it worthwhile to do so? Well, having a PCP is important, even if you rarely go to the doctor or get sick. For starters, your PCP is the single best resource for knowing and understanding your health. This includes knowledge of your personal and family health history and risk factors, the medications you're taking, and your overall lifestyle. He or she can make sure you're getting the care you need and are up to date on any age, gender preventive screenings or immunizations that may be needed. Additionally, in the event that you get sick, your PCP can easily treat many non-urgent health issues like colds, flus, rashes, allergies, and respiratory infections. Also, the cost of seeing an in-network PCP under your plan is significantly less than going to an urgent care facility or an emergency room. Seeing a PCP for health issues is one of your lowest cost options of care. Now, earlier in the presentation, we discussed some of the reasons why it's important to select a primary care physician during annual enrollment. Now, as a reminder, if you're on the statewide network, your PCP is responsible for managing any referrals to specialists that may be needed. The referrals are typically in effect for up to a year and are only required for the Active Care Primary Plus and Active Care Primary members. Now, to prevent denied claims, please keep in mind that if you're on the statewide plans, every covered family member needs their own PCP selected. So, for example, mom and 2 kids, all covered on the same plan. Mom must choose a PCP for herself during annual enrollment, and she must also select one for the kids. It can be the same doctor or different, but each family member must have a PCP tied to him or her. Now, for those on the Primary Plus or Primary plan, if you don't use your PCP for routine medical care, or if you go out of network, or if you don't get referrals from your PCP for in-network providers before seeing the specialist, you will not have coverage. Your claims will deny and you'll be responsible for those charges. Now, I want to let you know these statewide plans provide you a great way to focus on your health while reducing your out-of-pocket. Now, keep in mind, once you select a PCP, it's good to establish care early on in case you need a specialist down the road. Now that we've taken a dive into the different plan offerings and their advantages, I want to switch gears and discuss the various tools and resources available to you and your covered family members. The first tool we will discuss is the participant website. We want to encourage you to utilize the member website as your first stop for medical benefits and any health and wellness information. This website is dedicated to the TRS Active Care plans. It will have coverage-specific information that will be helpful for you throughout the year. The member website has feature options to include finding an in-network provider, checking the cost of doctors and services covered under your plan prior to receiving the treatment. You can easily download forms and documents, and you have the ability to download a temporary ID card. We want you to think of Blue Access for Members, or BAM, as the hub for all member medical benefits needs. To get started, you'll first need to register by going to the URL here at the bottom of the screen and by clicking on Login as shown at the top right-hand corner with that red circle. Now, when you first sign up, you'll need to have your member ID number to create your personalized account. If you don't have your ID number, you can contact one of our personal health guides or the benefits administrator at your district. Now, as a quick note, the Blue Access for Member portal is available in Spanish and English. You can access the Provider Finder search tool from the Active Care site by clicking on the Doctors and Hospitals tab and then choosing the plan for which you want to search providers. Now, on the left-hand side of the screen, we see a screenshot of our provider finder within the Active Care member site. This is a tool we encourage you to use when selecting a primary care provider. Now, when you search for a provider, you're going to get more than just a list of doctors. You're going to gain access to quality designations, enhanced demographic information. You can customize your search. Say you only want to have a female doctor, you can search by that. You can look at patient reviews to see what other people have to say about the doctor. And you can check for alternate locations. So maybe it's more convenient to have a doctor located near your work than your home. Additionally, this tool is available in Spanish and English. Now, after completing a search and clicking on the provider's name, it will take you to the detailed provider page, which is shown here at the top right. Take a look at the red circle. This is where you can locate the provider's PCP ID, which was shown earlier on the ID card for the statewide plans. Now, this PCP ID will be needed during enrollment if you are electing the primary and primary plus plan, either as a new hire or if you're switching from the HD or AC2 plans. If you're already on the Primary Plus and Primary Plan and you're just wanting to change your PCP, you'll need to do so through BAM or by contacting a personal health guide. Now, keep in mind, if you're uncertain how to navigate this page or having difficulties, you can contact our personal health guides who are available 24/7. Let's take a look at our mobile resource, which is an excellent tool for you to utilize. With the Blue Access for Members and Blue Cross and Blue Shield Texas app, your benefits are at your fingertips, wherever you are. Our online tools are going to help you stay informed and better manage your health and wellness benefits. I wanted to note a few feature options about the mobile app. You can use the app to find those in-network doctors, access claims and coverage, deductible information. You can view authorizations and referrals. You can download and share explanation benefits. You can get push notifications and have access to a message center. You can even chat live with our PhDs. You can view your ID card and add it to the Apple Wallet if you have an iPhone, or you can email it to your provider. This has proven super helpful to me because I typically leave my house without my ID card. The Blue Cross and Blue Shield Texas app is also available in Spanish for both iPhone and Android users. One of the most useful resources available to you and your covered family members are our personal health guides. Blue Cross and Blue Shield of Texas personal health guides, or PhDs, are here to help you and your covered family members with anything. For instance, they can help you in finding and assigning your PCP, answers questions regarding your benefits and coverage, checking the status of authorizations and referrals. They can help you understand your healthcare costs and options for care, and they'll help you schedule appointments with the doctors and receive those referrals. They can help you navigate the participant website and mobile tools, and they can connect you with a nurse to help you learn more about a diagnosis or medical condition and identify resources available to you right there in your community. Now, remember, there is one toll-free number to call, and I highly recommend you add it to your contact list. It's 866-355-5999. A Blue Cross and Blue Shield of Texas personal health guide is available to assist you and your covered family members 24/7. Now, I know your benefits administrator's plate is full, so reach out to a PhD instead. Now we want to talk about the benefits that are offered on the TRS Active Care plans in addition to the health ones, the health and wellness ones, which include family planning resources for you to be healthier together. I'm excited to tell you about how you can earn member rewards through a feature in a provider finder. When you're signed into BAM, the tool uses your specific benefit information to provide you an estimate based on the Blue Cross and Blue Shield Texas contracted amount with different providers and your remaining responsibility for the year, such as whether you have met your deductible or whether you have reached your maximum out of pocket for the plan year. On the left here, you can see how Member Rewards uses Provider Finder to help you reduce costs and take more control of your healthcare financial decisions. Member Rewards is available on the TRS Active Care Primary Plus and TRS Active Care Primary plans. Now, here on the right, you'll see how you can take advantage of the Member Rewards program. Most of us look for value when we're shopping for everyday items, so why not apply this to the shopping for healthcare services? Did you know prices for the same quality medical service can differ by thousands of dollars within the same region and health plan network? Member Rewards is a program that offers you rewards deposited directly to a healthcare account, that's an HCA, when you select a lower cost quality provider from several options. These funds can be used toward future copays, coinsurance, and deductible amounts for an expense during the same plan year. Compare it to where you park your car, the $30 lot or the $15 just a few blocks away. Member Rewards allows you to compare your healthcare services in a similar way, and the differences can be significant. Best of all, using Member Rewards could minimize out-of-pocket costs. As we like to say, same procedure, different costs, and potential cash in your pocket. Now, another fantastic offering we have for you is the 24/7 Nurse Line, which is staffed by registered nurses, again, 24/7, to conveniently assist by answering general health questions and guide you to the appropriate level of care, whether it's a visit to your PCP, virtual health provider, urgent care, or if you really need to go to the emergency room. A unique feature of the Nurse Line is that you can have access to an audio health library that has information on over 300 topics, which are available in English and Spanish. You have access to the 24/7 Nurse Line, and they can be reached at that same 866 number. And this phone number will be located on the back of your Blue Cross and Blue Shield ID cards. Now, TRS recognizes and understands the needs of their population being predominantly female. Therefore, we have tools to help those who are pregnant or planning to get pregnant at no extra cost. Ovia Health apps are for tracking your cycle, pregnancy, and baby's growth. Each app has videos, tips, coaching, and more. Plus, for individuals with a high-risk pregnancy, Ovia will provide support from maternity specialists to help care for the member and her baby. Now, the first step in getting started on your journey with Ovia is shown here on the right-hand side of the screen. Note that you can download the app by going to the Apple Store or Google Play. You'll create an account and choose I have Ovia Health as a benefit before selecting Sign Up, and then you select your health plan. You'll be prompted to indicate Teacher Retirement System of Texas as your employer. Now, you'll need to have your member ID card handy so you can enter your Blue Cross and Blue Shield Texas ID number when first setting up your account. Another great tool is the Well on Target member portal, which is where you'll start engaging in wellness activities and innovative programs that are tailored to you, including the ones listed on the right-hand side of the screen. Now, Well on Target is unique because it recognizes that every individual has their own health journey. There are several activities on the Well on Target to encourage you and help you along your wellness journey. Some of these include syncing a fitness or nutrition device or app. You can find programs on key health topics and have access to a personal health coach. You can also earn Blue Points rewards by participating in eligible wellness activities on the portal. We'll discuss these in a bit. There are multiple digital self-managed programs available to help you hit your health targets. We have coaches who are credentialed health experts that are cross-trained and have degrees in specialized areas and at least 5 years of experience. There are 9 topics from which to choose, and all communication with a health coach will be through secure messaging or telephonically. Coaching is purely optional, confidential, free, and they can assist you in reaching your health goals. Now, when you complete a health assessment, this will trigger an outreach from a coach through secure messaging. Earlier, I mentioned that you can earn Blue Points rewards by participating in eligible wellness activities on the portal and redeem them on our online shopping mall, which has over 1 million products from which to choose. Now, I recently used my points to buy a vacuum because I didn't want to spend my own money on it. So I thought, why not my points? But you can also choose from Fitbits, camping gear, jewelry, etc. Now, in the Well on Target portal, you'll be able to see all the activities listed and their corresponding point value. The points add up quickly, they never expire, they roll over from year to year. Now, you can get started with a bang by completing a health assessment, which rewards you with 2,500 points. I'm excited to discuss the great options and features to our fitness program. The fitness program provides you with tiered membership options for unlimited access to more than 11,000 plus participating facilities nationwide, from gyms and sports facilities to specialty fitness studios and more. You can do a simple zip code search to locate a gym close to you and choose a membership plan that works best for you and your budget. Now, you'll have the option to select between 4 tiers, and regardless of which tier you select, the one-time $19 initiation fee will be the same across all 4 tiers. The fitness program is family-friendly as it expands gym network access to cover dependents at a bundled price discount. This year, we have enhanced our fitness program by adding a new digital-only plan option. This digital online platform platform, which is offered by Burnalong, gives you full unlimited access to live classes and digital fitness videos. There's no initiation for the digital only option. And now we're going to talk about how you can sign up. You can easily enroll for the fitness program through the Blue Access for Member portal or by phone. Once enrolled, you can locate participating gyms in your area, and this is usually done by entering a zip code. Once you have successfully signed up, you will need to take your Blue Cross and Blue Shield ID card to the desired gym, and you'll sign any applicable gym waivers and start your journey. Another great perk about the fitness program is if you are traveling for business or vacation, you'll have access to in-network gym facilities nationwide. Now, as a reminder, here is the number to reach out to our personal health guides and the URL for the TRS participant website. This is all I have for you, and thank you so much for your time.